It disconnect. Disconnect. How do you make it one by one? Escape.
Disconnect the screens, please.
Audio visual. I'll disconnect my screens. TV screens disconnect ಮಾಡಿ. Disconnect ಮಾಡಿದ್ರಾ? No. That only. Car Pedicriticon card. Okay. Yeah. ಆಗಿಲ್ಲ. Okay. Sorry for the delay. We had a little technical modification to be done. It's been done now. So without any ado, we'll start with the first round. Team A ready? My volunteers ready? Scorekeeper. So I need one timekeeper. Oh.
1 minute for each.
10 seconds. 10 seconds.
Till round 4.
We don't have a bell.
Bell ಇಟ್ಕೊಂಡು ಕೂತಿದ್ದೀರಲ್ಲ, ಅದೇ ಇರುತ್ತೆ timer. Bell ಎಲ್ಲಿ? I think they are just get it by them.
Sindhu, you can tell them. We'll tell. Okay. The first question. Okay. Steam starts now. A simple guide for pediatric blood pressure, that is the lower limit of systolic blood pressure for 1 to 10-year-old should be. There's a formula guide which you should tell.
2A plus 70.
2A plus
70.
2A means?
Age. A stands for age.
Okay, fine. That's correct. Good. 10 marks. So if they have answered correctly, you need not write. It will not come to you. Okay. So team B ready? Defibrillation dose recommended for children in first shock in VF/pulseless VT is? Loudly. Loudly. On the mic.
2 or
Okay, time up. No, the answer is wrong. Take others. Collect ಮಾಡ್ಕೊಳ್ಳಿ. So you should immediately collect as soon as. Anybody? ನೀವು ಇಟ್ಕೊಂತೀರಾ? Okay. C. Okay. Yeah. All. Huh? What did you say? 2 what? 0.05 you said. What is 2 or 0.5? That's not correct, na? Or I can't take. I can take 0.5 then. Comes wrong. That's okay. The others have answered. It is 2 joules per kg. All of you have answered. All of them get 5 marks each. Yeah.
Except the BT, yeah?
Except the.
A also gets 5.
Yeah. Fine. Okay. C team, you're ready? Okay. The recommended time to start intraosseous access in patient with cardiopulmonary arrest who have failed IV line is approximately within. Others can write and give your slips
90 seconds.
loudly.
90 seconds.
Yeah, you're correct. 90 seconds is the correct answer. So keep the slips with you. The next question, team D. You ready? Your mic is correct?
Yes, sir.
Okay, timer. Which of the following is the most common type of shock in children worldwide? Others can write the answer. Most common type of shock worldwide.
Hypovolemic shock.
10. Who's answered?
Hypovolemic shock.
Yeah, correct. The answer is correct. Hypovolemic shock. Okay, team E, you are ready?
Yes, sir.
Scorer, you're able to maintain. They've got a correct answer. They've got a correct answer. Okay. A 5-year-old boy is brought to casualty unconscious after road traffic accident. He opens his eyes in response to pain, utters inappropriate words. He has abnormal flexion, painful stimuli. According to above data, the GCS is. Others can write.
How much around?
10 seconds will cut.
12. 12.
Time
12.
up.
12.
12. Okay. Time up. Please correct your answers. Wrong.
You are having the answer?
No.
No, you gave.
You all gave 4 bantala. Nobody. No, okay. None of them. Huh? ಎಷ್ಟು ಬಂದಿದೆ? Yeah. No, bar. No, the answer is 9. The red ones is what I have marked there. Sound is 3. It is more than 2 years old. And incomprehensible words and abnormal flexion to pain. Ah, C is correct answer. C. Okay. Round ಆಯ್ತಾ? So what's our score at the end of first round? Loudly.
A15, B0, C20, D15, and E5.
Yeah, 2 people in 15. Good, nice. This is a little light round, so it's going smoothly. Fine. So, audience, this is your question for you. There's something called connections. I know you can use these two figures to connect to a word. So, whoever tries this gets a prize. Chocolate. Connect these two to the word, to a word, which is medically related. Okay, 10 seconds only. No? Time up. Time up. Anybody else? So the answer is incentive spirometry. That's incentive. And that's spirometry. Yeah? Good. Okay. Fine. So shall we start round 2? Fine. From here. Again round 2. So next we will come back after this. Ready? Okay. Your first question starts now. A 6-year-old boy presents with acute onset abdominal pain and vomiting followed by drooping of eyelids and quadriparesis within 2 hours. On examination, he has shallow breathing, copious secretions, saturation of 86 in room air and ptosis. Which is the most likely diagnosis? Most likely diagnosis. Others can write.
OP poisoning.
OP poisoning. Okay, others can write. Give their answers. That's not the correct answer. Quickly collect. Over. You have only 5 seconds. You can't take such a long time. Leave it. They're out. Give. Next you give. You're not written. You're not written. Okay, anybody else? No. So we've got 2 teams who have answered.
Who is this? This one, D.
D. You should.
D. You have to write your team.
Team
You
name.
have to write your team C, 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 D, D, D on all the chips. C
Okay.
and D gets.
C and D have got the correct answer. The answer is neuroparalytic snake animation. Okay, fine. So the next question is to team B. Ready? Time starts now. The most common form of cardiac rate or rhythm abnormality seen in GB syndrome. Time starts now. Others can write, and 5 seconds for that, and you should give it back. Time up. Please give your slips. Quickly. Volunteers, you should collect it quickly. Okay. Waiting. No. Nobody? Out. Nobody. So GB syndrome has parasympathetic activity and abnormal. So it's sinus tachycardia, which is more commonly seen. This is not. That is also a little abnormality. So it's as per Roger's textbook of intensive care. Okay. Team C. Nobody gets an answer here. Team C, your question starts now. The most common cause of spontaneous intracranial hemorrhage in childhood is. Others can write and collect the slips once they're done. Time up.
Hypertension.
Slips, please. Give it a show. Team B has written CMV. What does it mean? Huh? Sorry, loudly. Cytomegalovirus. Okay. I didn't understand D. And what is this? No. See, there's nothing is on. AV. Okay, none of you get the correct answer. The answer is an AV malformation. It's parenchymal and intracranial. Parenchymal bleeds. It's not ventricular bleeds or anything else. No, it's not infectious condition. The uplift most common cause even Nelson gives as vascular malformation. So that's the top card. Okay, fine. Next team is team D. You ready for a question? Starts now. The most common cause of unilateral diaphragmatic paralysis in infants is time up. Please give us slips. Okay. No, it's infants. Okay. Anyway, the answer is trauma from a cardiothoracic surgery. This is an upfront cause for a unilateral diaphragmatic paralysis in infants, not newborn, not birth. So this is the most common from a palliative repair of a congenital heart disease is what is seen. Okay. Example like BT shunt and other things. So next team, E. You ready? This round seems to be a little up and down here. Okay, fine. I thought this round will be easier. Fine. Okay, the question starts now. Mortality from tetanus is most commonly secondary to abnormalities in which system? Write your answer.
CNS.
CNS. Okay. Anybody else? Others answer. CVS. Neuromuscular, and yeah, respiratory distress. Who's written B? Yeah, your closest is B. Its mortality is secondary to respiratory abnormalities, most commonly aspiration, laryngospasm, laryngeal spasm, and hypoxemia, not CNS. CNS is relatively preserved. Fluke shot, huh? Got it, huh? Good. Then that's nice. Really good. So that's the most common cause of mortality in tetanus. And next is cardiac abnormalities, parasympathetic activity, and those things. B gets 5 marks. So end of round 2. Can we have the score? No, you total up the whole thing. So their previous plus this. So in the this is the audience question by the time she totals. Audience, try to answer this. Let them try. Yeah? Yeah, correct. Who told first? Chocolate. Who's having? Sindhu, chocolate. Good. Shots and sight. Gun sights. Good. It's short sight. Okay. Now tell the score, please.
D is 15, D is 5, C is 25, D is 50, and D is 20, and E is
So we have C leading here with 25 marks, followed by D 20, A at 15, and E at 5. E and B and E has to buck up. Start. Huh? You still have some more rounds. You can do something. Still, there is good way. Not a long gap though. You still have a lot of chances. B and D rest can keep up the good work. The leading team. Shall we start the next round? Ready? So the next round will start from E. It will go in anti-clockwise. So 2 rounds of anti-clockwise. Okay? Just your time starts now. This is your question. In a patient with iron poisoning who is receiving desferoxamine, the most accurate method for measurement of iron is
TABC. Total iron binding capacity.
Okay. Others have written down. Please give your serum ferritin. Saturation. Cardiac MRI. Well, this might have been a little tough question. Anyway, the answer is spectrometric method, where you a level of iron is meant in a toxicity, not in general deficiency and other things. So this is the calorimetric method is generally done, but because of overload on desferoxamine, there can be false positive or false negative. That is why you use atomic absorption spectroscopic method. Okay, fine. This is a little higher one. Okay, don't worry. Next question, team D. The half-life of salicylate therapeutic dose is normally 2 to 4 hours. You know that. This may be as long as 20 hours in setting of overdose. Why does this happen? Others can write the answer. Paracetamol you give 4th hourly, na? But this is in toxicity, it's more.
Sir,
The time is up. We'll still give you.
glutathione deficiency.
Close. I can't give you that. Okay, the answer is this. This normal metabolic way is Michael-Menton's kinetics, which is a saturable form of kinetics. So this metabolic pathway becomes completely saturated, and the alternative pathway has to be there. So the salicylate has to get directly excreted from urine, from sweat, and that is the alternate way when this metabolic pathway is saturated. It is not the enzyme deficiency there. So that is why our answer is saturation of the regular pathway. That would have been a simple answer though. Okay, fine. No, you're NQS saturation. No, that's not. I saw that. Saturation word. No, you didn't mean this. Okay. The next question goes to team C. You ready? Fine. Dysrhythmias associated with tricyclic antidepressants are best treated with. Okay, time up.
Lignocaine.
Others, please give your answers if you have written.
Lignocaine.
Lignocaine. No, you told lignocaine. You told. Okay. No, that's not the answer. The answer is this. Bicarbonate. Okay. For tricyclic antidepressants, because of to minimize the binding of CAs to the sodium channels and the myocardium with resultant suppression of dysthymias. This is as for Goldfrank. Okay, fine. Next team is B. Team B ready? Your question comes. Hypotension in a poisoned child is most closely associated with, but this most closely due to what? Why do you get hypertension this is a general answer for any poisoned child. Why do you most commonly get hypertension? Okay. Others can write their answers.
Volleyball.
Not sure? Loudly. I'll give you chance. Vasodilatation. Vasodilatation. That's it. The answer is hypovolemia. It's significant. Other etiologies must be kept in mind and appropriately. There could be cardiac, there could be suppression, but most commonly it's hypovolemia. Okay. Again, this is Goldfrank. Okay, team A ready? The clinical usefulness of hemoperfusion is most dependent on which of the following features in drug toxin. When you're trying to excrete a drug toxin, you use hemoperfusion method. You want to know how the usefulness, how does it work? What is the thing which... I don't want a drug, I want the mechanism of usefulness of hemo is dependent on hemoperfusion works on what method is what I'm trying to ask here. Others
Binding
can write.
capacity of to the
Sorry?
binding capacity.
Binding
to
capacity.
hemoglobin.
Okay. Close. Let us see. What is this? C has written what? Volume of distribution. Diffusion. Alpha losses. Diffusion. I think binding. Distribution. Yeah. You're highly water soluble and poorly protein bound. If the drug is poorly protein bound and highly water soluble, hemoperfusion works well. That's what we wanted. For any component to be dialyzed efficiently, it must be poorly protein bound, less than 90% and highly water soluble, so that they have a smaller VD, volume of distribution. And so the majority of the drug in the plasma have a smaller molecular weight and with higher are dialysable. Okay. Fine. We finished end of round 3. Can you total the scores and tell us? By the time you do it, we have a question for the audience. What is this? 10 seconds only, yeah? Audience. Flashcard. Yeah. Give it there. Somebody got it correct. Who? Yes, Harry Potter, half-blooded Prince Charles. So, Harry Potter's half-blooded prince. How many have you seen that? Harry Potter fans? Oh, there are, but very less. I'm also a fan. So, okay. Fan? Yeah. Huh? It's a movie. It's a Harry Potter is a very fictional character. It's there are a series of 5 movies, very entertaining. 8 movies. Yeah, I have the full collection of the books. It's nice. Okay. Um, round 4. So again, it starts from your E. You ready? We'll start now. What is the most common chest radiograph finding in sarcoidosis? Others can write. Or time up. Those who have written, please give us slips. Yeah, I think A and C have answered correctly. The bilateral hilar adenopathy is the most common, although you can see interstitial lung disease and a reticulonodular shadow pattern. And in ocular, bilateral hilar adenopathy is most frequent and earliest sign on a chest X-ray in sarcoidosis. Good answer. So 5 marks for a team. Which one? A and C. Noted? Yeah. Okay. Question was for E. Now D. Your direct question to D. So the question 2, a 9-year-old boy develops abrupt onset dyspnea, tachypnea, fever, and non-productive cough with decreasing oxygen saturation. Examination is not conclusive. He has been diagnosed with ALL 9 months ago and is now on maintenance chemotherapy. Lab tests showed decreased WBC count. Chest X-ray reveals bilateral diffuse interstitial ground glass infiltrates. Of the following, the organism that is most likely to be detected by BAL is, which is the most common organism you would like to expect in BAL? Your time starts now.
Candidiasis.
Candidiasis. Okay. Others can write. Others have written by this time. Okay. We've got we've got 3 people, A, B, and C, who got it correct. The answer is pneumocystis jirovecii. Good. Fine. You add 5 marks to. Okay. We'll go to the. No. Oh God. Change it off. Okay. The next question for team C. This is your question. A 6-year-old girl develops low-grade fever, headache, and flu-like illness. She then develops bilateral cheek erythema, followed by diffuse macular rash over the trunk and extensors of extremities, with central clearing in some areas, giving a reticulate appearance. Soles and palms are spared. Which is the most common diagnosis in this? Others can write.
Erythema infectious.
Okay. I think you're right. Yeah, your answer is right. Direct marks, 10 marks to team C. Good. Okay.
Displayed. So answers are displayed. Answers are visible.
I want to take my seniors are here. The answers were seen, but should we change? So
Answers
we will
were
not
seen,
be
sir.
unfair on our part. Next one also. Yeah, we'll nullify this question. I'll give you another question. So please switch off this. Switch off. We can't go. Even the next one is also seen. Okay, that is also seen. Till the audience question. Oh my God. I can post the audience question. That I will do. I'll just put the buffer. I have 4 buffers. Okay. One second. Yeah. We'll just say one. Wait. 1 second. 1 second. Wait.
That also listed. E5 is the E4 verbal.
Take it off. On ಮಾಡಿ. This is your question now. Which of the following condition is most common cause of hospitalization and death in patients with sickle cell disease?
Thrombosis.
Thrombosis. Others can give your answers, please. D, what have you written? D, what have you written? D. The what? What have you written this? Huh? Influenza. Okay, influenza. Okay, none of you get the answer right. The answer is an acute chest crisis. It's not vasoconstriction, chest crisis. So this leads to admission. Hypoxemia is higher in that, and that's the next question goes to team B. You ready? Okay. The dose and route of adrenaline anaphylaxis is
1 in 10,000, 0.0
1 ml per kg, 1 in 10,000 dilution.
dilution.
okay. It's 0.1 ml per kg, 1 in 10,000 adrenaline.
0.01.
Okay, time up. Others, give your answer, please. You are corrected. You're saying 0.01 ml per kg, 1 in 10,000.
10,000.
Don't change your answers. Check my. The answer is 0.1 1 ml per kg, 0.01 ml per kg of dose of 1 in 1000. That's which is 1 in 1 mg per 1 ml is the strength. So I don't think anybody has written this correctly. You have told the answer correctly. 1 in 10,000. Yes. Yes, you told 1 in 10,000. I repeated it. That's only A gets it. 1 in 1000, 0.01 mg per kg. Yeah, this is correct. D is not written. You've written IV. You've written IV. No, it's anaphylaxis, it's IM, it's not IV. You've written IV, and you've not written the route there. Yeah. You're not clear here also. It looks like 10,000 here. 1 is to 10,000 here. That's right. Okay. C writes it as IV. Not be getting marks. So only you'll get the marks. 5 marks for it. So your next question for A, which is the most common extraintestinal manifestation of celiac disease?
Diabetes, like
Pardon?
diabetes.
Diabetes.
Autoimmune.
Autoimmune diabetes. Others, please give your answer. What man, so small. What have you written here? Just check it out, Bardiana. Huh?
uveitis.
Okay, I have presbyopia also. Okay, none of you get the answers. Right, the answer is iron deficiency anemia. Small absorption, very common manifestation of celiac disease. You see, na, skin changes, iron deficiency anemia, failure to thrive, chronic diarrhea. So, fine. We come to the end of round three. Round three is done. Round four, sorry, round four is done. Okay, go. Please switch this off.
Sir,
Give an audience question. It's off, madam. I want to move it. Off, huh? The audience, switch on, Madi. Switch on, Madi. Okay, this is the audience question, 10 seconds. You could interchange this if you want the word to come correctly. These two, you could mix match. There's a little difference there. Anybody got it? Huh? Yeah, correct. High frequency oscillatory ventilation. Okay. He got it. So our first regular rounds are up. We've done two clockwise, two anti-clockwise. We come to two more rounds are left at this point. Can we have our score at this?
Team A has scored 30 points, B has scored 10 points, C has scored 35 points, leading, D has scored 20 points, and E has 5 points.
So the trend seems to be consistently on our side. Other team, please buck up. You still have two more rounds. Rapid fire will make a difference. You can still fire back, and all the best. Okay, good, great going now. We'll come to our fifth round. Is the visual round. So visual round. I do not have videos because it's for the load sake. You'll get a picture and a question. So you will be given 10 seconds. After 10 seconds, the image will switch it off. You will not be able to see it, and then you have to answer. There is no pass in this, no slips. It's only direct question. We're not going to give any slips. All are direct questions. So 5 questions. Okay. None off. Andag off ಮಾಡಬೇಕು. Okay. Round 5. The first question. 10 seconds. Team A. The first question starts off here. Sorry. This is sorry. We have. Correct. The visual round is not wrong. Okay. Yeah. A 6-year-old presents with high temperature for 3 days despite negative blood and CSF cultures. A computerized tomography scan of the brain reveals 2 centimeter ring enhancing lesion, the most likely predisposing condition. I'm sorry, 1 second. 1 second, I'm sorry. Just switch off, Madi. Because this is, we've stopped at round 4. We've got 7 rounds. Switch off. Got this wrong. This is audio vision. There are 5 teams. 5 rounds. We did only 4 rounds. Again, we 5 rounds. We do only 4 rounds. Round 5. Okay, on Madi. Okay. So this is your question. The figure represents a relationship between intracranial volume and intracranial pressure and volume. Most of the initial compensation that leads to shift from position B to A is a result of what? In this ICP. Okay, 10 seconds starts.
Decrease in the cerebral perfusion pressure.
Decrease in the cerebral perfusion pressure. Okay, fine. The answer is egress of CSF from the intracranial to intraspinal space. That's a modification. It tries to compensate initially by pushing out the CSF. That's how the pressure actually comes down. That's the mechanism. So your answer is not. I can't give you marks for this. Next question. Team B, ready? So, what is this port used for? You've seen this. I think you would have seen this in a ventilator. What is that port used for? It's okay, we'll not change. I'll give you 10 seconds to answer.
Sample boom.
Sampling port. Okay. I can't give you marks. What do you meant by sampling? To take ball and all.
Sam in CPAP be attached to.
CPAP attached to it. No, I can't give you marks for that. It's a EtCO2 side port sampling. Generally, you have EtCO2 in the mainstream and the side port. The side port can be used for sample this. It's a EtCO2 side port sampling. Okay. The next question, visual round for team C. What does these arrows indicate in this linear time scalar? Your 10 seconds. Okay.
Curar waves.
Yeah. Yes.
Curar waves.
Not waves. Curar. You're correct. What is this scalar? It's in capnography. Yes, capnography, correct. So when you're paralyzed a child and when he's recovering from paralysis, when the child tries to breathe, there will be a cleft. It's called Curer cleft. Okay, because they used to use tuberculin before as neuroparalytic agent. Yeah, we'll give you marks for this. It's excellent. That was a nice answer. Very good. Okay, team D ready? So this circled part on this PV loop, you should tell me what does that indicate? What does that circled area indicate? Okay, fine. It indicates spontaneous ventilation. The PV loop is generally, you can go back. This is a normal ventilation. Non-assisted ventilation, the mechanical. When a patient tries to take a breath, there's a negative pressure deflection and goes like that. That is a completely spontaneous breathing. So this is a assisted ventilation where patient is breathing. That's what we wanted to pick you up. When you see this, you are paralyzed, they would be like this. Start breathing, you can see this coming in a PV loop. Okay, team E, you're ready? Which abnormality caused this hydrocephalus in the CT scan? Okay, I can give you a clue to others. Audience wants to try. Pileocytoma. Anybody else? It's very smooth. It's probably a vascular. Can you think of some vascular stuff? Vessel related, congenital. Vein of Galen-Mark. Quite common. We see a lot of cases. Okay. So we're done with round.
Can you switch off?
Switch off. Switch off. Okay. Fine. At the end of the audiovisual round, we want a score, please.
A has 30 points, B has 10 points, C is leading with 45 points, D is 20 points, and E is 5 points.
Okay. So the leader seems to be C consistently. But you still have a rapid round, a last round after this. There are 8 questions and 10 marks each. There's no negative marking. In 1 minute, you should be taking, it's yes, no, yes, no, yes, no. So how many yeses and no's you get it, you will be totaled and given. And you still have a chance to score and win. So there's a good chance. Now, when they say yes, no, I want you to write down. ನೀವು ಮೂವ್ ಮಾಡ್ತೀರಾ ಸ್ವಿಚ್ ಆನ್ ಮಾಡಿ ನಾನು ಮೂವ್ ಮಾಡಿ So you're ready, team? Ready? A timer, 1 minute. Okay. Yeah. Start.
Yes, ma'am. Yes.
So you can, if you don't know, you can just quickly go.
If you say pass, we'll go to the next one.
We can
Should-
come back to the same.
You can come back within the 1 minute.
Okay.
If you don't have time, you'll not be able to come back. Okay. Yeah.
Ready?
Yes.
Okay. Starts now. First, the drug of choice in mycoplasma pneumonia is
Azithromycin.
I don't know. Which drug is associated with purple glove syndrome?
Pass.
Oseltamivir has no role after 48 hours of flu infection. Yes, no.
No.
Ribavirin is recommended in all RSV pneumonias. Yes, no.
No.
Narrowest part of airway in infants.
Subglottis.
Subglottis. Okay. Recommended number of chest compressions in a minute.
100 to 120.
100 to 120. Name two high flow devices.
HFNC and like NIPV, like non-invasive. CPAP.
CPAP. Okay. Fine. Which artery is checked in pulse during pulse
Brachial.
check in infants? Brachial.
Uh,
Okay.
drug of choice.
You want to go for, you have some time? Yeah. 5 more seconds for purple glove syndrome.
To bank.
Okay. Okay, done. The answers are this. I can't give you for NIV. It's a ventilation. I asked for a high flow system. Ventilation is not a high flow system. Okay. Non-rebreathing mask or high flow. In CPAP, you ventilate. It's a type of non-invasive ventilation. As per definition, it is not high flow. Okay. So I'll give you half mark for that. The rest of the questions, how much they've got now? 5.5. That's 55 marks. 55 marks. That's a good thing. Give them a big round of applause. Excellent. Team B, you are ready?
Yes. Yes, what happened? So you got question 1 correct. Question 3 was wrong. Okay, oseltamivir has no effect after 48 hours. You should have answered yes. You said no. Okay, so that's wrong. Question 4 right. Question 5 right. Question 6 you got it right. Question 8 also you got it right. Question 7 partially right. So that makes it
5.5.
5.5. Okay. No doubts? You got target, that's what you're.
I know you got
Don't
confused.
be in a hurry.
That's the idea, isn't it?
So all you say it can be used.
It can be
Or
used.
no role, whatever. Yeah.
Okay. Next, team B, ready? Okay. Your time starts now. CPR breath rate recommended in infants.
1:3.
Sorry?
It says
Breath rate
30.
30. Okay. Return of spontaneous circulation refers to
Heart rate more than 60.
heart rate more than 60. Okay. ETCO2 is recommended during CPR. Yes or no?
Yes.
Yes. Diastolic BP monitoring is recommended if arterial line is existent. Yes, no.
No.
No. One risk of CPR, compression ventilation ratio is
30.
loudly
30 is to 9.
30 is to 2.
9. 1. 1.
1. Dose of IV adrenaline during cardiac arrest.
0.1 ml per kg in 1:10,000 dilution.
Okay. Any two components of high quality CPR.
Chest recoil. Chest come.
Your time is up.
Chest.
I will not be able to give you the other question. Half chest recoil. Okay. The answers are this 20 to 30. So we've given you the first one. Reappearance of central pulse, not heart rate. Central pulse, carotid or femoral or brachial. That is ROSC. You will not use a stent in CPR. Yes, the second answer is correct. Third answer is correct. Tell me.
Third is the first answer you got right. Second is wrong. Third one is correct. Fourth again they got wrong. Fifth and sixth they get it. Seventh we give you half mark for complete chest recoil. Yeah.
So
Thank
4.5 marks, 45. Okay, team C ready? Fine. Your question starts now. Name the normogram used for paracetamol poisoning in patients.
Rumac Matthew normogram.
Okay. Is gastric lavage recommended in camphor poisoning? Yes or no?
No.
No. Does dose of ASV in Cobra Bite with innovation? Cobra Bite innovation.
Pass.
Pass. Scorpion innovation drug of choice.
Prazosin.
Prazosin. Prazosin. Okay. OP poisoning antidote.
Atropine.
Antidote for PCT poisoning is
Acetylcysteine. N-acetylcysteine.
score used for burns injury classification.
Pass.
Name the chart used in ER for measuring weight in an unresponsive child. Somebody is pointing. You have time for others if you can try. Your time is still there.
Sir, third question.
5 seconds.
10 vials
Which is 10 vials?
ASV.
Okay. Fine. Your time is up. The answers are Rumak Matthew. Which all you got? 6 marks. Your second, 60 marks. That's good. Give them a big round of applause. Yeah. Team D, you're ready? The time starts now. Apneic oxygenation is recommended during intubation. Yes, no.
Yes.
Midazolam is favorable for induction in intubating hypotensive child. Yes, no.
No.
Which aid is awarded in metabolic diseases?
Pass.
ETCO is a gold standard for confirmation of ET2 endotracheal intubation.
Yes.
Choice of fluid in burns resuscitation.
RL. Ringer lactate.
DK, any two criteria for DK?
Kussmaul breathe and
For diagnosis of DK.
respiratory acidosis. Metabolic acidosis and pass. Next.
Pass.
Next question.
Most common rhythm in pediatric cardiac arrest.
Pass.
Drug of choice for SVT.
Adenosine.
Adenosine.
7 SVT. 7 SVT, sir.
Choice for SVT, correct.
Yes.
You are telling for 7 is SVT.
Yes.
No. The time is up.
1, 2, 3, 4, 5 questions they get right.
Okay.
Okay,
Thank you.
50 points.
This
So
is
they
your
get-
answer. Sodium valproate was ringer lactate is correct. You should tell blood glucose more than 200, ketonemia more than 3 millimole, pH less than 7.3, or bicarb less than 18. Any of these four, two of should have been told. They've not told. You're not told that. Asystole is the most common, not SVT, in cardiac arrest. Rest are correct. Okay, good. Give them a how much? They get 50 marks. That's a very good attempt. Good. Okay, time. You ready? Team E. Fine. Name any two benzodiazepines used in seizure management.
Midazolam and lorazepam.
Okay. Which aid is avoided in ASD spectrum children?
Phenobarbital.
Next. Preferred ETT. You have answered phenobarbital. Preferred ETT for pediatric self-intubation is cuffed or uncuffed?
Uncuffed.
Define refractory status epilepticus.
After starting two anti-epileptic drugs.
Two anti-epileptic drugs. Neuroprotective measure, the most important drug.
Mannitol.
Which AKA classification is followed in pediatrics?
Kedigo.
Steroid of choice in group.
Which one? Budecort. Hydrocort.
Hydrocort. Group, the scoring for group scoring. Name. The time is up.
So they get 3 questions right. Okay, so yeah, you can have the answers. Yeah, it is lorazepam as you answered actually. Levetiracetam is something that has to be avoided. And cuffed ET tube, that's universal. Okay, you have to use cuffed ET tube. I think refractory, they got it right. Mannitol is not upright recommended in children. Okay, at least it has evidence in non-traumatic brain injuries, that is in acute CNS infections. Kedigo, dexamethasone, no? Hydrocort we don't use. Okay, it's a we need a more potent steroid over here. Okay, and that is Wesley scoring.
Wesley group scoring. Okay, can we have the score at end?
Team A has 85 points. Team B has 55 points. Team C has 105 points. Team D has 70 points. And Team E has 35 points.
That's excellent. There is a good balance, and here and there, all of them have really fought well. We've actually, but the Team C has consistently performed throughout the scoring, and as they have emerged as winners with 105 marks, followed by Team A, which is 85 marks, and then the third runner-up would be Team D, 70. The other two teams are very close neck to neck. Team B at 55 and Team E at 35. Congratulations to all of you. Thank you. Thank you. We will, Arun. Arun.
So congratulations. The winning or losing doesn't matter. Actually, it is the participation which matters. You have come down to the stage to learn, to read, and to go back with the knowledge. Don't worry about the losing or winning. Okay. This is just a momentum to study hard. Well, good. Okay. So don't worry. So once again, this was actually a Dr. M.T. Suresh Babu sponsored quiz in the memorial of him, which is sponsored by Dr. Pranam Gowder. He was supposed to be give a talk to yesterday actually, but some because of some NMC commitments he could not come. So he has given his certificates. First new Kodi. New sign. Scientific first side. Meanwhile, you can give the comments, sir.
Okay, you all tell me, how did you all feel? It was very tough. Okay, balanced. No, I need a feedback from you all. Huh?
Sir, it's actually very good, sir. When our HOD has to participate in that, we hesitated, sir. But it's a matter of studying and practicing the like what we are done in the ward work. So both are there. So it's very good.
Okay. Anybody else wants to tell? How do you guys feel?
Sir, the round turn little harsh on us, sir. Questions are very tough to us.
I'm sorry, you chose the E. I have no choice. I've tried to balance, but I had to increase a little strength and little down. I can't make it like just an MD quiz. It has a critical care quiz. Have to be components of critical care. And since you are MD students, your critical care aspects won't be so robust like you like us, for example. We are day in day out we read, but it's probably straightforward to many of my fellows or the intensivists. But we try to keep us simple, keeping only emergency and thing. But quiz is a mix and match, and I have not tried to keep system wise. That becomes very biased. I've just taken it randomly how it comes, so that there is a random choice for everybody. Any comments? Rapid fire, we try to keep it as simple as possible. It was quite approachable. We just keep 2 to 1. You could have hit there. That's where I think they caught up. They did well. What? Any comments? The comments? They are the first years. All of second years, no? Yes. You are the junior most. You did well for the beginners. No, really. You should. This is an impetus to read well, study. So you. You took it up very well and did well. So good. So please continue reading and enjoy studies. And it's actually fun. You'll enjoy. Okay. Seniors, they want to tell me anything? Comments? Most welcome. I need to change. This is my. I've done 1 or 2 cases in Indira Gandhi, but.
And
I appreciate the quiz master, and the way of conduction was also very good. A few more audience questions would have been better. That's all. Only one comment. Thank you.
I'll look into it next time. I didn't want to give any scientific questions. I wanted to give some thought-provoking ones. Okay, ready?
Yes, we'll call them. 11 names. 6 teams names.
Team A, team B ne karti.
Okay.
ಆಮೇಲೆ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಅಲ್ಲೇ ಇಲ್ಲೇ ಇರಲಿ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಎಲ್ಲರೂ ಫೋಟೋ ತಗೊಂಡು
Yes. But ಅಲ್ಲ ಟೀಮ್ ಎ ಇಸ್ ವಿಚ್ ಪ್ಲೇಸ್ ಅಂತ ಗೊತ್ತಿಲ್ಲ.
ಟೀಮ್ ಫಸ್ಟ್ ಅಲ್ಲ ಟೀಮ್ ಎಲ್ಲ ವಿನ್ನಿಂಗ್ ಟೀಮ್
Winning team. Okay. I would like to invite Team C onto the dais, please. Sir, Anand sir. Box. They are the winners of this quiz competition. Yes, yes. We really appreciate your time. Yeah. So, certificates. Chandan sir, certificates, winner certificates. Please introduce yourself.
Myself Chetana. I am second year junior resident in pediatrics from Ballari Medical College, Ballari.
I am Sushmita, junior resident 2 from BMCRC Ballari.
The first 2 teams get the certificate.
ಕೊಡಿ ನೀವು ಕೊಡಿ ಬನ್ನಿ That's a sponsor medal for you. ಕೊಟ್ಬಿಡಿ ಸರ್ ಯಶಸ್ವಿನಿ ಬನ್ನಿ ವೆರಿ ಸಿಂಪಲ್ ಸಿಂಧು ನೀವು ಬನ್ನಿ ಸಿಂಧು ಬನ್ನಿ Team B. So the first runner-up is Team A with 85 marks. Team A, please come on stage. Please introduce yourselves. And
I'm Dr. Rekha. I'm a second year pediatric PG from MIMS Mandya.
Dr. Dhanush, second year postgraduate from MIMS Mandya.
ಇಲ್ಲ ಇದೆ ಕ್ವಿಜ್ ಮಾಸ್ಟರ್ಗೆ ಸಪರೇಟ್ ಇದೆಯಾ ಇಲ್ಲ ಅಲ್ಲ ಓಕೆ
ಸರ್ಟಿಫಿಕೇಟ್ ಇಲ್ಲ ಕ್ವಿಜ್ ಮಾಸ್ಟರ್
ಕುಮಾರ್ ಸರ್ ಪ್ಲೀಸ್ ಕಮ್ ಸರ್ಟಿಫಿಕೇಟ್ ಬರೀ ಸರ್ಟಿಫಿಕೇಟ್ ಲಿಸ್ಟ್ ಕರೆಕ್ಟ್ ಇಲ್ಲಿ ಕೊಡಿ ಕುಮಾರ್ ಸರ್ ಕೊಡಿ
introduction. Tell yourselves.
Myself, Dr. Murli. I'm second year PG in District Hospital, Tumkur.
Myself, Dr. Vinod, junior resident from District Hospital, Tumkur.
ಎಷ್ಟಿದೆ ಇದು ಇನ್ನೊಂದು ಸೆಟ್ಟಾ ಹಾಂ
ನೀವೇನು
ಇಲ್ಲ ಇಲ್ಲ ನಾನು ಕ್ವಿಜ್ ಮಾಸ್ಟರ್ಗೆ ಸಪ್ರೇಟ್ ಕೊಡ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರು ಅದಕ್ಕೆ ನೋಡ್ತಾ ಇದ್ದೀನಿ ಇಲ್ಲಿದೆ ಇಟ್ಸ್ ಎ ಇಲ್ಲ ಇಟ್ಸ್ ಎ ಫ್ಯಾಕಲ್ಟಿ ಇದು ದಿಸ್ ಇಸ್ ಇದು ಇದರಲ್ಲಿ ಚಂದನ್ ಇಲ್ಲಿ. Can I have Chandan sir here, please? Yeah. Okay. No, it's fine. It's fine. It's fine. Thank you. ಕೊಡಿ. ಇಲ್ಲ ಇದು ಫಸ್ಟ್ ಕೊಟ್ಬಿಡಿ.
Yeah. Introduce.
I'm Dr. Jeevita, first year PG, doing in Siddhartha Medical College. Thank you.
I'm Harshita, first year PG from Siddhartha Medical College.
ಎಲ್ಲ ಜೊತೆಗೆ ನಾನು ಇರ್ತಿದ್ದೆ ತಮ್ಮ ಇದೆಲ್ಲ ಏನೋ ತಮಾಷೆ ಮಾತಾಡ್ಕೊತ ಗೋಕಳಕ್ಕೆ ಪ್ರಹ್ಲಾದ್ ಟೈಮ್ಸ್ ಎಲ್ಲ ಮಾಡಿದ್ರಿ ಓದಿ ಚೆನ್ನಾಗಿ ಇಟ್ಸ್ ಬಿಗಿನಿಂಗ್ ಸಿದ್ದು ಕಮ್ ಸಿದ್ದು ಕಡೆ ಟೀಚರ್ ಓದಿ ಇಲ್ಲಿ ಚೆನ್ನಾಗಿ
Myself, Dr. Gani from Sridev Medical College.
Myself, Dr. Prem from Sridev Medical College.
ಅವರಿಗೆ ಇದಿಲ್ಲ ಫ್ಯಾಕಲ್ಟಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಇದು ಮಾಡಿ ಕೊಡಬೇಕು. ಅಲ್ಲ ಬಿ ಮೇಡಮ್ ಬರೀತಿದ್ರು. ಜಸ್ಟ್ ಮಿನಿಟ್ ಸರ್, ವಿ ಹ್ಯಾವ್ ಎ ಸರ್ಟಿಫಿಕೇಟ್ಸ್ ಫಾರ್ ಫ್ಯಾಕಲ್ಟಿ ಆಲ್ಸೋ. ಚೂರು ಮಾಡಿಕೊಡಿ. So we started the scientific sessions with scientific committee chairperson. We would also like to end with the scientific committee chairperson. May I request Dr. Kumar JV to hand over the certificate of appreciation to all the quiz masters, please. Please, I would request all the three persons to gather into the. We have utilized Keshavamurthy sir to the maximum. All the 3 days he was busy with maximum assignments. Yashaswini ma'am, please. Dr. Sindhu. Okay. We'll take a group photo with all the participants, please. All the quiz master and all the participants to assemble in the. Sir, but. ಅಲ್ಲೇ ಮಾಡೋಣ. ಓಕೆ. ವಿಲ್ ಸಿಟ್ ಹಿಯರ್. ನೀವು ಸ್ಟೂಡೆಂಟ್ಸ್ನ ಇಲ್ಲಿ ನಿಲ್ಲಿಸಿ. ನಾವು ಕೂತ್ಕೋತೀವಿ. ಹೌದು. ಹಾಂ ಅಂದರೆ ಇವ್ರು ಕೂತ್ಕೋ ಎಲ್ಲರೂ ಅವರು ಇವರು ಸ್ಟೂಡೆಂಟ್ಸ್. ನಾವು ಫಸ್ಟ್ ನಿಂತ್ಕೊಂಡು
ಅಲ್ಲ ನಾವು ಎಲ್ಲ ಜೊತೆ ನಿಂತ್ಕೊಂಡ್ಬಿಡೋಣ.
ಓಕೆ ಸರ್,
ಎಲ್ಲ ಜೊತೆ ನಿಂತ್ಕೊಳ್ಳೋಣ ಬಿಡಿ, ಬೇಡ
ಬೇಡ.
Good evening to all. So we have come to the end of the sessions. I thank each one of you who have participated in this scientific academic week, 2 days. I hope you got a lot of memories to carry on, and it should be the beginning of learning. So each one of us have an opportunity to learn and share our thoughts. I think it has served the purpose of the conference. So I wholeheartedly thank each one of you. So we'll be closing the session. Thank you one and all.
Thank you, sir. I would like to extend my heartfelt gratitude to all the quiz masters and all the enthusiastic participants and the audience who made it a great event. And now, as we come to the close of the Pedicriticon 2025, we can proudly say that these past 2 to 3 days have been a memorable blend of fruitful discussions and many rich academics. This conference has been more than just an academic event, and who have made this possible by their untiring efforts, and many individuals and teams working behind all these scenes. On behalf of the organizing committee, I would like to place on record my heartfelt appreciation to Abhinava Events Tumkuru, Mr. Prajwal, Pavan, and team. I would like to request them on stage. They have been working since more than 1 or 2 months to make this event a grand success. They have been supporting us with each and everything without even saying anything. They've been smiling all throughout the event. They've made it a very big success. A very big thank you to all of you guys. Thank you so much. May we have a great, good, big of applause to all of them. I request our organizing committee members to present them a token of appreciation. can see. Thank you. Thank you. I would like to thank the Swati caterers who have served us with all the delicacies throughout 2 days. I sincerely thank all the supervisor of technical team from Sridevi Medical College who have ensured smooth running of every session, and a special thanks to all the pharmaceutical colleagues sponsors whose generous support added immune value to this conference. Above all, I extend my deep gratitude to our organizing committee whose hard work, planning and commitment have been the backbone of this success. I would like to conclude this session by thanking all the enthusiastic speakers, chairpersons, delegates, volunteers, etc. And a special mention and thank you to the chief patrons of organizing committee, Dr. Shukumar sir, Madhu Hetsi sir, Satyanarayan sir, Mallikarjun sir, and Srinivas sir. And organizing chairperson, Dr. Ashok sir, organizing co-chairperson, Dr. Lakshmikant sir, chief organizing secretary, Dr. Chandan sir, and organizing secretaries, Dr. Arun Kumar sir, Pallavi ma'am, Srinivas Prasad sir, and scientific committee chairperson, Dr. G.V. Kumar sir, treasurer, Dr. Ishwar sir, joint treasurer, Dr. Sumant H. Patil sir, joint secretaries, Dr. Manjesh sir, Madhusudan sir, Vinay sir, Shilpa ma'am, Maunesh Patta sir, and workshop coordinators, Dr. Rasan Suresh sir, Chandan sir, and Madhu Chandan sir. Thank you each and everyone whose patient and enthusiastic involvement has made this event a great success. Thank you everyone. Special thanks to our enthusiastic volunteers who've been with us for more than 2 to 3 days, more than 8 to 10 hours with us, and with their smiles, they have encouraged us to do more than them. Thank you so much. Thank you.
I would like to extend my gratitude to stage committee comprising of Dr. Apurva, Dr. Ganashri, Dr. Pooja. Thank you. Thanks everyone.